Hi, today will be medical talk number 7. It will be about cancer 2 oncology, which is the treatment of cancer. Introduction. While most anti-cancer treatment cause some side effects, the side effects can be managed by other medicines at home, so you don't have to be in the hospital. So cancer treatment can be used with either curative or palliative intent. Curative is you want to cure the person to achieve complete remission. Surgery, for example, surgery to remove all the tumors. Other methods can also be used to cure. So adjuvant therapy is to give therapy after the surgery, for example, radiotherapy or drugs. Neoadjuvant therapy is to give drugs before the surgery. Yeah, so before and after the surgery also there is therapies. Yeah, therapies basically means treatment. Palliative intent is when the cancer cannot be cured, so you just want to improve the quality of life, treat and prevent symptoms, or improve survival. Yeah, make the person live longer lah. So the types of treatment, there are 6 types. Surgery and radiotherapy is outside the body, whereas systemic anti-cancer, there are 4 types. Okay, these are all drugs. Okay, 4 types of drugs. One type which is radiotherapy using radio wave. Another is surgery. Okay, we'll go through each of them. Surgery is the main cure of tumors. The cure is very highly successful if it is detected and operated early. There is also evidence that the outcome is related to surgical expertise. So nowadays, surgeons specialize in removing specific cancers in overseas. I'm not sure about Malaysia. And sometimes they can use radio frequency to remove the tumor, or they can use microwave to remove the tumor, or they can use cryotherapy. They put a very cold negative Celsius instrument on the tumor to freeze it. Yeah. So you go on to radiotherapy. Radiotherapy is using ionizing radiation, such as X-ray, gamma rays, electrons, or charged atoms. It will damage cancer cell DNA. It can be internal or external beam, but normal tissue will also be damaged. So what they do now, the latest technology, is they use CT scan or MRI scan to scan the size and shape of the tumor and feed the beam accordingly. And the latest technology can also do stereostatic. Stereostatic means the beam is delivered from different angles, from the side, from the front, from the back. And the internal beam is common for prostate, uterus, and cervix. So they put a device near the thing, and then they use it for 10 to 20 minutes. Right. For near the uterus or cervix, they put a device there for 10 to 20 minutes. For prostate, they will place a small radioactive seed inside the body, and this seed will slowly produce radioactive elements to kill the cancer. The strategy is to deliver radiation in small doses on a daily basis, perhaps over 4 to 7 weeks, so that the normal cells can recover from the radiation damage, whereas recovery in malignant cells is less quick. So the cancer cells will die first before the normal cells. The side effects include skin reaction, inflammation near the site, and some people, 5 to 10 of the people, develop side effects more than 6 weeks after treatment. And the risk is they can have new cancer because the radiotherapy itself can cause new cancers. So the next one is cytotoxic chemotherapy. So this is a drug that you eat. Okay, it will interfere with the process of cell division. It is good for fast-growing cancers. The problem is it will affect other cells, not just the cancer cells. So people will have hair loss, tired, vomiting, infertility. And how much dose depends on how fast the normal cells in the bone marrow can recover. Yeah, so if you can eat 100 drugs a day, but you will die first, right? So you have to see how fast can the bone marrow recover, how fast can the bone marrow build new cells to recover. And you need to take other drugs to stop the side effects. it can cause life-threatening complications from the bone marrow problem. So hormone therapy is less bad lah. The number 2 and number 3 is very toxic. Number 4 is less, but it's still a bit toxic. So hormones can signal tumors to grow. It will block, so just block the hormone path, right? Because tumors, how they grow, what is telling the tumors to grow is certain hormones. So you block the hormone, then the tumor cannot grow. So in 80% of breast tumors, they are positive for estrogen receptor. So the hormone estrogen is asking the tumor to grow. So they just block the estrogen receptor, right? It can also be used after surgery to prevent relapse. It is as good as chemotherapy. Remissions can last for months to years. It is less toxic than chemotherapy. Now we go to targeted therapies. Targeted therapies is the 5th type. It is the drug. It is a kind of drug that targets the proteins or genes of the cancer cells. So if we can identify it will only attack the cancer cells, right? So what they have, first you have to test what is the molecule of the cancer. You need to do a biopsy, go inside, cut out a molecule of the cancer, test it, and confirm whether this drug can work on this, will kill this cancer cell. So if it can kill this cancer cell, then you can use it. There are two specific groups. One is the negative MAB group, one is the negative IB group, right? So one targets the expression outside of the cancer cell. So if the cancer like to produce some kind of chemical, it will target whatever cell that is producing this chemical. Another one target the cell itself, so you will enter inside the cell and kill the cell. So now this is the latest technology. They are very wide range now used in oncological practice. Yeah, people don't like chemotherapy so much. So the side effects, of course, there are side effects. It depends on the molecular pathway being targeted. Okay. Sometimes it can affect other molecules, other cells as well. So you can use, for example, it will overcome mutation. So some cells like to mutate very fast, so it will target the mutations. Some cells, is uncontrolled cell division, so they will target just the cancer cells. The last one is immunotherapy. This one encourages the immune system to attack cancer cells. There are many checkpoints in the immune system to stop white blood cells from attacking normal cells. But cancer cells use this way to evade the white blood cells, so they pretend to be normal cells. So what this drug do is inhibit the checkpoint molecules. So now the white blood cells will simply attack any cell. So they use it to treat skin cancer, renal cell cancer, lung and bladder. This is the latest. This one is just came into the market, and it can be used. You can use multiple checkpoint inhibitors or other drugs. You can combine with other drugs, like the previous category, like the specific, like these targeted therapies. You can use together. Okay, so and then there are also vaccines. Now they are developing vaccines to boost the immune system's ability to recognize and destroy cancer cells. It is likely to become more prevalent in the future. Because why? Because this kind of therapy, immunotherapy, is good for advanced cancers to prolong life. For example, metastatic melanoma, which is skin cancer, which can spread very fast. Normally the patient will die within 6 to 8 months using normal medicine, normal drugs. But using this kind of drugs, they can live for more than 5 years in clinical trials. But the problem is there will be problem with the immune system, because now the white blood cells attack normal cells. Yeah, so it can be life-threatening as well. And after treatment, they need to use radiological, like X-ray or biochemical monitoring, to see whether the tumor has disappeared, whether it is gone. And they have to do toxicity checklist to see your hair got dropped, your nails, what happened to your nails, what happened to your skin. They want to see lah, how are you responding to the toxicity. So late toxicity, some people get toxic symptoms after. One, in radiotherapy, for example, it can retard bone and cartilage growth, it can impair intellect and cognitive function, it can affect the pituitary glands. Chemotherapy can cause heart failure due to cardiotoxicity, lung, kidney, and brain toxic problems. Yeah, so both of the number 2 and number 3 got a lot of toxic problems. In conclusion, first we have to have a pre-treatment, and then we need to have the treatment itself, and then we need to have post-treatment, which is adjuvant treatment, and then we need to have post-medicine to cure the side effects, and then we need to evaluate, see whether the cancer is gone or not, and then we have to deal with the side effects lah, whether it is infertility or whatever. So surgery is best to cure. Radiotherapy and chemotherapy is toxic. Hormone and targeted therapies are less toxic. Immunotherapy, the problem is it causes white blood cells to attack normal cells. So they have to find a way to develop better drugs lah in the future. Most advanced now is targeted therapies, right? The last 3. Immunotherapy will become more widely used in the future. So one drug can cost 100 to 1,000. So be happy if you do not have cancer. Thank you.